Have you ever wondered how the healthcare industry requirements have changed over time? Let's take a journey back, say, 50 years or so. The healthcare landscape was a different beast entirely. A keen focus was placed on formal education and training. Doctors, nurses, and other healthcare professionals spent years honing their craft, learning the intricate details of human anatomy, mastering complex surgical procedures, and understanding the myriad of conditions that can affect our health. The medical licensure was another non-negotiable requirement, a golden ticket that validated the professional's competence and ability to practice medicine. Alongside this, hands-on experience was a valued commodity, as there's no better teacher than experience itself. Fast forward to the present day, and you'll find that while the core requirements have remained, they've been joined by a host of new expectations. In this digital age, literacy in technology is no longer a luxury but a necessity. Healthcare professionals now need to navigate electronic health records, utilize telemedicine platforms, and even incorporate artificial intelligence into their practice. But that's not all. The healthcare industry has also recognized the importance of interpersonal skills. Empathy, communication, and emotional intelligence play a crucial role in providing patient-centered care. It's not just about treating a disease anymore, it's about understanding the person behind the illness, their fears, their hopes, and their needs. Additionally, as our societies become more diverse, cultural competence has emerged as a key requirement. Healthcare professionals are expected to respect and understand the cultural backgrounds of their patients, to provide care that is sensitive to their beliefs, values, and customs. This evolution reflects the changing dynamics of our world. The healthcare industry is not just about the science of medicine anymore, it's about the art of caring, the understanding of diverse cultures, and the mastery of digital tools. As you can see, the healthcare industry has evolved significantly, and so has its requirements. And as we continue to advance, who knows what new requirements will become essential in the future. But rest assured, they will be there, shaping the industry and challenging us to adapt and grow. Did you know that digital literacy has become a fundamental requirement in today's healthcare industry? The advent of technology has significantly altered the landscape of healthcare, revolutionizing the way professionals in the field operate. These changes are not mere flashes in the pan, but rather the new normal. The impact of technology in healthcare is profound, and it has transformed the way healthcare professionals work, making digital literacy an essential skill. Digital tools have become integral to the healthcare industry. Electronic health records, or EHRs for instance, have replaced traditional paper charts in many healthcare settings. These digital records allow for real-time access to patient information, enabling healthcare providers to make quicker, more informed decisions about patient care. However, using EHRs requires a certain level of digital literacy. Without it, the potential for errors increases, which could negatively impact patient care. The rise of telehealth platforms is another example of the digital transformation in healthcare. Using these platforms, healthcare professionals can consult with patients remotely, making healthcare more accessible, especially for those who may have difficulty traveling to a physical location. But again, to use these platforms effectively, healthcare professionals must be digitally literate. They need to understand how to navigate these platforms, troubleshoot potential issues, and ensure patient information remains secure. The list goes on, from digital imaging and diagnostics to the use of artificial intelligence in patient care. The role of technology in healthcare is expansive and it's only set to grow. As such, healthcare professionals need to be tech-savvy. They need to understand the tools they're using and be able to adapt as new technologies emerge. In essence, being digitally literate is not just about knowing how to use a computer or a smartphone, it's about understanding and using technology to provide quality care. It's about being able to adapt and thrive in the digital age of healthcare. So being digitally literate is no longer an option but a necessity in the healthcare industry. Who said soft skills are not important in healthcare? You see, the landscape of healthcare is changing. It's not just about the hard skills anymore, the ability to diagnose a disease or perform surgery. Soft skills have become equally important. Let's take a look at a few examples. Communication is a critical soft skill in healthcare. It's not just about conveying information clearly and effectively, it's also about listening. As a healthcare professional, your ability to listen to your patients, understand their concerns, and respond in a reassuring manner can greatly enhance patient satisfaction. It can make the difference between a patient feeling heard and understood, or feeling dismissed and frustrated. Next, we have empathy. Empathy is about understanding and sharing the feelings of others. In a healthcare setting, this means being able to place yourself in your patient's shoes, to truly understand their worries, their fears, and their pain. This sort of empathic understanding can help to build strong patient relationships, and it's something that can't be taught in medical school. Problem solving is another crucial soft skill. In healthcare, unexpected issues and challenges can arise at any moment. The ability to think on your feet, to assess a situation quickly and make informed decisions is invaluable. This isn't just about solving medical problems, it's also about navigating the complexities of the healthcare system and finding solutions that work for your patients and your team. And let's not forget about team collaboration. Healthcare is a team sport. Nurses, doctors, technicians, administrators, they all need to work together to provide the best possible care. The ability to collaborate effectively, to respect the views and expertise of others, and to work towards a common goal is absolutely essential. So you see, soft skills are not just nice to have in healthcare, they are a necessity. They help to build strong patient relationships, improve patient satisfaction, and enhance team collaboration. They are crucial for the delivery of high-quality, patient-centered care. Indeed, soft skills have become as important as hard skills in the healthcare industry. Can cultural competence make a difference in healthcare? Absolutely. In today's globalized world, our communities are more diverse than ever. This diversity extends into healthcare, where professionals are tasked with caring for patients from all walks of life. Enter cultural competence, a crucial tool in the modern healthcare professional's toolkit. But what exactly is cultural competence? Cultural competence refers to the ability to interact effectively with people of different cultures. In the healthcare setting, this means understanding and respecting patients' cultural backgrounds and experiences, and incorporating this understanding into the provision of healthcare services. It's about appreciating the richness of human diversity and using it to provide better care. Cultural competence is not just about being polite or politically correct, it's about improving patient care. Studies show that culturally competent care can increase patient satisfaction, improve patient outcomes, and reduce health disparities. For example, a patient is more likely to follow a treatment plan if they feel their healthcare provider understands their cultural background and values. Moreover, cultural competence can promote health equity. Health equity is about everyone having a fair and just opportunity to be as healthy as possible. By being culturally competent, healthcare providers can better understand and address the unique health needs and barriers faced by different cultural groups. This can help reduce health disparities and make our healthcare system more equitable. So, how can healthcare professionals become culturally competent? It involves continuous learning and self-reflection. It involves seeking out and respecting diverse perspectives. It involves listening with empathy and communicating with sensitivity. It's not easy, but it's worth it. In conclusion, cultural competence is no longer optional in healthcare. It's a necessity. Healthcare professionals must be culturally competent to serve diverse patient populations effectively. They must be able to navigate cultural differences and leverage them to provide high-quality, person-centered care. Cultural competence is not just a trend, but a new requirement in the healthcare industry. What does the future hold for healthcare requirements? As we stride into the future, healthcare requirements are set to be shaped by a wave of innovation and technological advancement. From artificial intelligence to virtual reality, emerging technologies are redefining the landscape of healthcare. Artificial intelligence, or AI, is not just a buzzword, it's a game changer. It's permeating every aspect of healthcare, from diagnostics to treatment planning, from patient care to administrative tasks. As AI becomes more sophisticated, healthcare professionals will need to adapt and evolve. They'll need to understand how to leverage AI, how to interpret AI-generated data, and how to communicate these insights to patients. Virtual reality, or VR, is another technology that's making waves. It's being used in medical training, patient education, and even in therapeutic interventions. In the future, healthcare professionals might need to be adept at using VR tools, whether it's for simulating surgical procedures or for helping patients manage chronic pain. These technologies, along with others like blockchain and genomics, are pushing the boundaries of what's possible in healthcare. But they're also raising new questions and challenges. How do we ensure the ethical use of these technologies? How do we balance efficiency with empathy? How do we protect patient data in an increasingly digital world? Healthcare professionals of the future will need to grapple with these questions. They'll need to be tech-savvy, but also ethical and empathetic. They'll need to be lifelong learners, always ready to update their skills and knowledge. The future of healthcare requirements is not just about mastering new technologies. It's about understanding the human implications of these technologies. It's about navigating the complexities of a rapidly changing world while keeping the patient at the center of everything we do. So, whether you're a seasoned healthcare professional or a newcomer to the field, the future is an exciting place. It's a place of potential, of innovation, of challenges to overcome and opportunities to seize. The future of healthcare requirements is dynamic and exciting, and we all need to be ready for it.